Well, my name is Shannon, and I'm going to be talking to you a little bit about medicine in the mid-19th century. Now, by this point in time, we are not relying solely on bleeding and purging in order to treat illness. We're actually divvying away from that and focusing on what might be inflaming the body. We're also using a lot of botanicals and medicines still. So I'm going to talk to you about some of the medicines that they used at this time, but also some of the treatments that they used to treat illnesses. Now, most of your healing is being done in the home, and a lot of it is being done by women. So you did have trained physicians and doctors. However, this is your frontline treatment for illnesses that's going to be coming from your women in your household generally. Now, if you were sick, let's say you had the sniffles, a cold today, one of the first things your physician, in this case, maybe your mother, maybe your wife, someone in your household is going to give you is a laxative to make you go to the bathroom, thinking that this is going to purge some of the bad things out of your body, that it's going to get rid of inflammation. One that they use quite frequently is calomel. And calomel is a form of mercury. It's a highly toxic heavy metal. You drink this stuff or you inject it in other ways, and it flushes your system out very, very quickly. Another, I don't have it right here, but actually another way of purging the system is to use substances like a tartar emetic, which is cream of tartar actually, which will also make you throw up. That's another way to purge your system out. Or magnesium. Magnesium was used very frequently as well. Now, in addition to your laxatives, your physicians also used a lot of opium. Now, opium is derived from a plant, the opium poppy. Papaver somniferum, I believe is the Latin name. And in order to extract the opium, what they would do is wait for the petals to die back where they have the seed pod, and then they would scratch the surface of the seed pod and a milky white sap comes out. Once the air hits that sap, it turns black, and they collect it, and that is your raw opium. Now, that will make you very sick to consume it like that. So what they found was if they mixed it with alcohol, that would help to dilute it and to preserve it and make it much more palatable to the system. They would put things like cinnamon in here as well. This substance is called laudanum. Now, laudanum would calm one down. It would help you deal with pain, but more importantly, it would help you if you had an upset stomach. So if you have diarrhea, diarrhea was actually one of the top killers in the 19th century. So this stuff would slow down your digestive tract just enough to help you keep things inside of you to hopefully allow you to live. Now, this substance right here, this is a patent medicine. You see it's a sun cholera mixture. Cholera is, the main symptom of cholera is actually diarrhea. It can kill you in less than 24 hours. You'll see that the main ingredients in here, one of them is opium. And this would be something you could just buy over the counter to take. All right. In addition to those medications, which were your most frequently used and combined, we also have some botanicals here on the table. Now, these three, we have lavender, chamomile, and peppermint, which would all be used to help calm the system, to help slow down the digestive tract. Again, we were talking about the opium, it sort of do the same thing, but they're not as potent. They will also help to deal with anxiety as well. Here I have coffee. Now, coffee is a stimulant, and it was very valuable, particularly during the American Civil War, because if you are sick, that little bit of caffeine, and particularly if it's combined with sugar, will help perk you up and help you feel better. So it was considered extremely valuable. This stuff over here is Sincona bark. It looks very similar to cinnamon, which I have right here, but it's not. Sincona comes from a plant that grows in South America. It's also known as the fever tree or Jesuit's bark, and that was used to treat fevers, in particularly one specific type of fever, and that was the that it worked the best for, and that's malarial fever. You would grind that up, mix it with alcohol, and you would get extract of Sincona. We have right here. It's very bitter. Now, what makes this work is that the main thing that's in it is quinine. And quinine kills the malaria parasite. Of course, at this time in history, they did not know that there was such a thing as the malaria parasite. If you were sick with these tertiary fevers that you would get with malaria, I thought, well, it's just a fever. We know this stuff works to treat fever. What it does is it kills that parasite that's in the system. You get bit by a mosquito, it gives you malaria. That malaria parasite is in your blood cells and it reproduces, and so each time you have a flare-up, you have more of these parasites in your bloodstream. This would kill that. And so during the American Civil War, this became incredibly valuable because this stuff was happening to be imported through the blockade. So it was not very cheap, but much more cheaper prior to the Civil War than it was during the Civil War, because it was much needed during that time. Let's see what else I have here. Okay, we'll talk about the hypodermic syringe. This is a hypodermic syringe. This was brand new technology. I believe this came around in this one here is from the 1870s actually. And this was used to inject morphine, which is a refined substance that comes from opium. And it was used for treating pain. And this was brand new technology at the time. A lot of physicians didn't really trust this because why would they inject medication using this when they can just use one of their own standbys to get medicine in the body real fast, which was this right here. This is a clyster or an enema. This may be something that your mother would have around the house if you lived in the 19th century. So again, you have the sniffles or you feel a little bad. One of the things that your mother or your physician is going to give you as a laxative. This is a way of administering that laxative or flushing out the system. It's inserted into the rectum and injects you with fluid, and that will make you go to the bathroom. It was also a way to get medicine in the body very quickly. However, as time goes on, your physicians are finding that this actually works a bit better to get medicine into the body. It's a bit quicker, it's a bit cleaner, and so as I like to tell school children, when you go to the doctor today and your doctor needs to get medicine in you quickly, which one do they use? And they're using the modern version of the hypodermic syringe. All right. So, hopefully we all brush our teeth. This is a 19th century tooth powder that I have here. Some of the ingredients are baking soda and cloves. It's abrasive and it helps freshen the breath. So in order to use this, you might just dip your toothbrush in here, or you wet the toothbrush first and brush your teeth. Now, they did fill cavities at the time. They did remove teeth at the time. One of the ways that you have two ways you can remove teeth if you don't take care of your teeth, of course. You have your dental pliers here, or you have a quicker way, and this is a tooth key. And you'll see here, I'll place it on my finger. We'll use a little bit of physics to show how this works. Just a little bit of pressure on the tooth key is pulling back my finger, so the dentist will place this in your mouth and just quickly turn it, and that should pop out the tooth. Now, I say should because if your roots are starting to rot, then it might not come out cleanly and they'll have to go in with the dental pliers. I'm not sure what I've covered so far.
Just one question. What was the risk of infection from the hypodermic needle being poked in, knowing the way germs were and things back then?
Well, you have to keep in mind they didn't understand the concept of germ theory at this time. Now, once we get into the 1870s, they are starting to understand this, and they're starting to practice cleanliness, particularly with Joseph Lister, who Listerine was actually named after, taught how to clean people prior to surgery and also after, and to clean the space and sanitize. So we're starting to do that by that point. But during the 1860s, 1850s, they don't do that. So if this is going to be used, Your physician's probably going to have just one of these, or maybe them, and maybe with a couple of needles. So you'll see it's a very large gauge needle. This will come in a case, and they might just rinse it out, clean it out if it's blocked, but they're not going to practice the sanitary practices that we do today. They're not just going to throw this in a sharps bag and then dispose of it that way. So also keep in mind, they didn't understand the germ theory. They also didn't have antibiotics. Those and sulfa drugs would not come about until the early mid 20th century. So you had some doctors who actually, if they saw that a wound had an infection, they might actually think that the body is healing. They would call that laudable pus. They thought the sign of that pus was a good thing, which today we know that no, that's not necessarily a good thing. Your idea of medicine and how the body worked was drastically evolving really, really quickly. There's a big change we'll say right at the end of the American Civil War and also the 1870s, all the way up to the mid 20th century. A big change in how medicine is and what people thought about it. And a lot of that falls in because of germ theory. And the understanding of germs and also other pathogens. Like we were discussing the Sincona bark and malaria. They had no idea that this little parasite was making people sick. They just knew you had a fever. It might be caused by a funky smell in the air. That's what was making you sick. Some bad swamp gas that was coming off and you were breathing it in. Or it might be caused by maybe some dirty blankets. But they didn't realize that there are other things that will make you sick that you cannot see, and it's not necessarily bad, stinky air.
I don't think you told us what this item here is.
Well, this is just a tiny little mortar and pestle. So if I were wanting to grind up, let's say some lavender here, you can't, with it being bigger, you can't actually take it into your system as well. So if I was wanting to make an extract of lavender, I would take the mortar and pestle and just grind it like that. You don't see it as much now, but the mortar and pestle actually was commonly seen as a representation of a pharmacist because they would use that to help create their medicine. So say for instance, I was wanting to make an extract or a tea, or a tincture, excuse me, I would grind these up, mix them with alcohol, and then perhaps add that to my laudanum in order to make it taste a little better, or perhaps calm the system a little bit better.